Hello everyone. Today we are going to learn about milieu therapy. So what is milieu therapy? Let me give a brief introduction about milieu therapy. So it is a form of psychotherapy that involves the use of therapeutic community. Milieu therapy is also called a therapeutic community. 30 patients join at a time in a group, and the duration of milieu therapy is 9 to 18 months. And during that stay, patients are encouraged to take responsibility for themselves and the other within the unit based upon a hierarchy of collective consequences. So now let's start with introduction. Milieu therapy is that the word milieu is the French for middle. So in French, milieu means middle. The English translation of the word is surrounding or environment. So we use surroundings or the environment in psychiatry therapy involving the milieu or environment may be called as milieu therapy. The therapeutic milieu is an environment that is structured and maintained as an ideal dynamic setting in which they work with the client. The milieu therapy includes safe physical surroundings, all the treatment team members and other clients. Next, we are going to see is the purpose of milieu therapy. So the purpose of milieu therapy is, the first one is redefine perception of stressor, correct the maladaptive behavior, develop adaptive coping, acquire interpersonal and stress management skills, manipulate the environment so that all aspects of client hospital experience are considered therapeutic. Client is expected to learn adaptive coping, interaction and relationship skills that can be generalized to other aspects of his or her life. And the last one is achieving client autonomy. Next, we are going to see the principle of milieu therapy. So the first principle is to promote fundamental respect for individuals, to use the opportunities for communication between client and staff for maximum therapeutic benefits, to encourage clients to cut at a level equal to their ability and to enhance their self-esteem, to promote socialization, to provide the opportunities for clients to be part of unit management, and individuals are held responsible for own action. So this was the principle. Client is expected to learn adaptive coping, interaction and relationship skills that can be generalized to other aspects of his or her life. Achieving client autonomy, peer pressure is utilized to reinforce rules and regulation. Team approach is used. Group discussion and temporary seclusions are favored approaches for acting out behavior. The nurse function is to act in a way that consistently promote those goals. So we have seen purpose and principles. Now we are going to see the characteristics. So first characteristic is distribution of power. Second one is open communication, structured interactions, work-related activity, communication and family involvement in treatment, adaptation of the environment to meet developmental needs. So let's see one by one. What happens in distribution of power? So the milieu therapy approaches involve flattening the control hierarchy so all participants have a voice in decision making. Whenever any decision is about to make, so hierarchy wise they can give their suggestions. This process may include the whole population of the treatment unit, or a governing council may take the final decision based on input from various smaller group of clients and staff members. Next is open communication. So in the therapy treatment, decisions are often made by the client themselves, who therefore need information to make effective decisions. It is not necessary to communicate personal information, but clients and staff need to be aware of individual treatment goals to ensure everyone is working towards the same goal. It means there is open communication between the client and a staff member so that they can help them to reach their goals. Next one is structured interaction. It is an interaction approach is that all staff members approach the client in a consistent manner, acknowledging specific diagnostic area, therapy shortening treatment time. Work-related activities. First, clients need to choose the type of work they wish to perform. Second, work activity should be geared towards developing skills that will be useful in actual job situation. And the third one is a variety of activities provide the opportunities to test different areas for future job interest. So the activity they are doing, it has to be work related. Next, community and family involvement in the treatment process. In this, a client are kept in their usual environment, for example, a day treatment center or a halfway home, and continue most of their routine activities while receiving treatment. Adaptation of the environment to meet the developmental need. To develop his full potential, an individual must have an environment adapted to his current need. Adapting the environment to meet these multiple needs is challenging due to the extension of milieu therapy to all age groups and the inclusion of family members with individuals of varying ages within the treatment of milieu. It means whenever they wanted to develop some needs, they need to adapt the environment, particular environment. Next is components. So there are 4 components: maintain self-environment, the trust relationship, building self-esteem, and limit settings. So maintaining safe environment, first one is dispose all needle safety and out of reach of client. It means needle should not be there around the client's environment. Then do not allow smoking. Restrict or monitor the use of matches and lighters. We are not supposed to use matches or lighters. Keep away sharp instruments from patient. Identify potential weapons, mop handlers, hammers, etc. Do not leave medicine unattended or unlocked. Be aware of items that are harmful if ingested. Example, mercury in the manometer. Next one is the trust relationship. One of the key to therapeutic environment is to establishment of trust. Trust is the foundation of therapeutic relationship, and limit settings and consistency are its building blocks. It means that without trust, we cannot build any relationship. Trust is very important in therapeutic or in therapy. Building self-therapy, accept the client as a person, be non-judgmental at all times, structure the client time and activities, initially provide the client with tasks, responsibility and activities, allow the client to make his own decision whenever possible, limit settings, state the expectation or limit as clearly, directly and simply as possible. The consequences that will follow the clients exceeding the limit also must be clearly stated at the outset. The consequences should immediately follow the clients exceeding the limit and must be consistent both over time and among staff. Now, what are the advantages of Milieu Therapy? So, it creates different type and attitude and behavior of client because of the environment like home. Patient learn to making decisions which improves his self-confidence. It develops a leadership skills. It becomes the socio-centric. It helps to learn, believe and think collectively with the members of the community. So this was the advantage. People will be having a different attitude and they will start making their own decisions. They develop a leadership skills and they will be socially involved in any social activities and they learn and live and think collectively. Next is disadvantages of Milieu Therapy. So role blurring between staff and patient. Milieu Therapy is limited to only hospitalized patients, require continuous open communication among all staff and clients. Group responsibility can easily become nobody's responsibility and low client to staff ratio. So these were the disadvantages of Milieu Therapy. And today let's conclude our topic about Milieu Therapy. So today we have seen the introduction. What is Milieu Therapy? So Milieu Therapy is nothing but we use surroundings or the environment to treat the patient in which patient is comfortable, right? Then we have seen purposes, principles. Then we have seen characteristics. In that, distribution of power, open communication, structured interaction, work-related activities, community and family involvement in the treatment process, adaptation of the environment to meet the developmental needs. We have seen components. In that, we have seen 4 components. Maintain self-environment, the trust relationship, building self-esteem and limit settings. Then we have seen each component in detail. Then we have seen advantages and disadvantages. Now the last one is role of nurse in Milieu Therapy. A nurse participates in the design and or renovation of the setting can greatly affect the therapeutic physical environment. The nurse is responsible for making the referral, encouraging client participation. The co-coordinator, all the team members is involved in team. The nurse may interrupt the needs of the client population for designing, expert with knowledge of color. Thank you.